Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help.
All right. Well, welcome back to the Wild Health Podcast. Today, we have Dr. Allison Mulcahy. Dr. Allison will be joining the Wild Health team in the near future. Unfortunately, the COVID pandemic has separated us before we were able to actually make it out there. And Dr. Mulcahy has two successful practices in Moab, Utah, and Jackson Hole, Wyoming. So that makes the rock climber and the skier in me like super jealous. And also, I was very disappointed that we couldn't actually do a face-to-face visit. But that said, Allison and I also have another thing in common. We have very unique backgrounds of how we ended up in the precision medicine and functional medicine space. So I'd like to give her the chance to introduce herself. So Allison, tell us a little bit about yourself.
Thanks, Jeremy. And first of all, thanks for everything that you all are doing at Wild Health during the pandemic. And thanks for having me on the podcast. I think everyone's getting a lot of great information from the podcasts that are going out daily, and I'm happy to help contribute. My background is emergency medicine, similar to yours, and I have worked in all sorts of different settings, from large academic centers to small community hospitals, and volunteering in a lot of places abroad over the years. A few years ago, due to my own body sort of getting old and developing some symptoms, I started developing some symptoms in my knee, which led me to discover regenerative medicine. I got PRP injections in my knee, which helped a lot. And then that just sort of led me down a rabbit hole of learning a lot about regenerative medicine. I completed a fellowship in integrative medicine down at University of Arizona last month with Andrew Weil. And I'm also doing a functional medicine fellowship with Chris Kresser. And ultimately, my own experience has led me to realize that if we don't address all of the root causes of everything to help get individuals healthy and help our immune systems to work like they're supposed to, we are not optimizing the way that we live. And I think after years of shift work and years of beating my body up, I do a lot of mountain biking and skiing. I just ran into a problem where a few years ago I realized that if I didn't make some changes, I wasn't going to be able to keep doing all the things I love. And that inspired me to learn and now to help patients to also get back to doing what they love.
I hear so many times from my own patients and even from just callers who inquire about our services that they're really looking for that root cause, that the real core of their illness or their problem. And I think that's just such an interesting way of looking at it. I sometimes feel like from a traditional medicine aspect, we miss that. And as you know very well, Wild Health is really a blend. I like to think of it as the crossroads of where traditional and evidence-based medicine meet functional medicine, meets the ancient arts and even lifestyle and proven therapies over the long term. And they kind of come together really find a best fit practice. And then you layer on top of that the lifestyle that's just ever so important. But I'd like you to tell us a little bit more about integrative medicine and functional medicine. So what are they? Can you give us more information about them?
Yeah, absolutely. That's a good question. And I think there's a lot of confusion around those terms right now and what it means. I think a lot of people have heard the terms, but then when they're really asked to explain what their understanding of it is, there's a lot of misunderstanding. So I think of integrative medicine as the big umbrella under which all healing modalities live. And so, and I should say all healing modalities with any evidence. And so under the umbrella of integrative medicine is conventional medicine, the type of medicine that you and I have been practicing for years, the type of medicine I think most people think of when they think about going to their doctor. Also under that umbrella, though, is naturopathic medicine, functional medicine, Ayurvedic medicine, traditional Chinese medicine, sound healing, massage therapy, supplements, botanicals. The list goes on and on. It's basically any sort of modality that helps an organism to maintain and restore health. And one really nice thing about the Integrative Medicine Fellowship that I did is they're the oldest Integrative Medicine Fellowship, and they've just compiled volumes and volumes of information and data on all of these different treatments. And you can imagine it's difficult sometimes to get evidence on things like sound healing because there's no one's making a bunch of money off of sound healing. But they've done an excellent job of compiling all that so that practitioners such as myself and you can spread the word to our patients. I think integrative medicine is particularly helpful with the SARS-CoV-2 pandemic right now, because if organisms are not healthy, they're going to be much more likely to be susceptible to disease and viruses. And this goes down to plants as well. So studies have been done on plants that are growing in nutrient poor soil versus nutrient dense soil. And I found this really interesting. The plants that are growing in nutrient poor soil are much more likely to be infested with insects and other organisms versus the plants that are growing in nutrient-rich soil have a lot more resilience. And I think that crosses over to us as humans. If we are taking care of ourselves and eating whole foods and getting all the nutrients that we need and getting the sleep that we need, we're much less likely to develop any infections or to be susceptible to a bad infection with SARS-CoV-2. So I think integrative medicine right now is more important than it's ever been in terms of keeping the world healthy.
That's such a great point. And we really believe strongly that the body's ability to heal itself is actually really one of the best, if not the best medicine available to us. And the concept of feeding ourselves and enriching ourselves with healthy activities, feeding ourselves well, and getting a good output is not only makes functional sense, but it also is supported by data. And we know that there are studies that show that people who sleep well more than 6 to 8 hours have better reactivity and better immunity after an influenza vaccination than, say, someone who doesn't. This is well supported in the literature. So I want to speak to you a little bit about some of your own practices and kind of what you're seeing from this SARS-CoV-2 virus. But before we jump into that, can you talk a little bit about how inflammation plays a role in COVID-19 infection?
Yeah, absolutely. So I think we're learning more and more, we being scientists and healthcare providers, that inflammation plays a role in pretty much every type of disease process that we currently have. So we know that inflammation, if our bodies are inflamed, we're more likely to have strokes and have heart attacks. We're more likely to have chronic pain. And in the case of the SARS-CoV-2 virus, inflammation plays a huge role in terms of whether or not people are going to have a asymptomatic course or whether or not they're going to have what we call the cytokine storm. And so the virulence and pathogenicity, including ARDS, which I know you've talked about a lot on your podcast, but ARDS is sort of like the end stage respiratory complications of this virus that is what ultimately is causing some people to end up on ventilators and some people to die. And so what that is a result of is the viral activation of something called the cytoplasmic NLRP3 inflammasome. And so basically the inflammasome is located within activated macrophages, and macrophages are cells that are part of our immune system. And they're also, the inflammasome is also located within Th1 immune cells. And so we need our immune system to fight off this virus. But what's happening is when this inflammasome gets activated and upregulated, it releases, in some cases, too many cytokines. It's always going to release some cytokines, and the cytokines that the inflammasome releases are IL-1B and IL-18. And they are what's responsible for the pathogenic inflammation and the virulence and the symptoms of COVID-19. And everyone's going to have some cytokines released if they actually develop symptoms with the virus, but some people are going to have more of those cytokines released. And the cytokines are important in our immune system, but too many of them can cause so much inflammation that we end up with fluid in our lungs. And so I think that's an important thing to understand when we're talking about how to decrease how to improve the outcomes once people get infected.
And there's so many studies and so many theories about what drives this. And I don't think we really even to date have a good understanding. And to put a timestamp on this, this is now Thursday, April 9th, 2020. So we know that you're exactly right. For some people, they're really susceptible to this cytokine storm. And I imagine that you're getting a lot of questions about this virus from your patients. So tell me, in your own practice, what are your patients asking you? And are they asking you about reducing their risks? And what are you telling them?
Yeah, I'm getting a lot of questions about, what can I do to prevent the chances of myself getting a severe infection. And I'm also getting questions from people who they think that they probably have had SARS-CoV-2 already, and they are wondering now, once they're infected, what they need to do. And then also questions from people that now have likely been infected and they're on the other side of things, and they're wondering what they can do to help with recovery. So I'm getting all of those questions. And as we all know, due to the shelter in place and in some places, a lot of people living under the same roof, I'm also sometimes answering questions about people in various stages of the infection all at once. So under the same roof, there might be someone that is acutely infected, coughing a lot, has a fever, and they feel awful. Someone else who, just got over those symptoms recently, and then other people who have not gotten symptoms yet and want to avoid sort of getting those bad symptoms. So everything along that spectrum. And in terms of what I am recommending, integrative medicine, as I talked about earlier, kind of encompasses a lot of different modalities. I think with SARS-CoV-2, the three important things that I've been talking to people about are adequate sleep, stress management, and then talking about specific supplements. People really, I think there's a lot of news out there about certain supplements being helpful, certain supplements maybe not being helpful. And so people are asking for a lot of clarification on that. In terms of sleep, you mentioned it a little bit, that with studies with the influenza vaccine, that if people have not been well rested, the vaccine does not take as well. They've also done studies looking at people who have been infected with, who've been exposed to rhinovirus. And super interesting, if people get fewer than 5 hours of sleep, they actually have an increased chance of developing rhinovirus by 350% compared with people who slept at least 7 hours per night. So I think sleep is kind of low-hanging fruit that I can kind of help coach people how to do that better. We know that sleep deprivation is going to increase the CXCL9 levels, and CXCL9 is a monokine which is induced by interferon, which increases lymphocytic infiltration. And that also is implicated in the NLRP3 inflammasome activation that I was talking about earlier. And so basically, if you have sleep deprivation, you're more likely to be to be releasing these inflammatory cytokines through the inflammasome activation, and then you're more likely to develop that cytokine storm. Additionally, sleep is going to ensure that we secrete adequate amounts of melatonin. And we know that melatonin also is helpful in inhibiting the inflammasome. And people have postulated that potentially part of the reason that older people are more susceptible in SARS-CoV-2 is because they don't sleep as well and they don't release as much melatonin. So I've been talking to people about various interventions that they can do to enhance their sleep. One of them is simply just taking melatonin, and there's really no high limit on taking too much melatonin. It's not like a sleeping medicine like Ambien, where if you take too much, you could stop breathing. Melatonin, I think they've done studies where they've tried to see if there's a high toxic dose, and they've actually stopped the study because they were not able to reach a level that was toxic. And so I think when you go to the store and you buy melatonin, generally you're getting something like 1 milligram, 3 milligrams, 5 milligrams. You can easily take 20 milligrams plus and not have any downsides. All of the sleep people that are studying sleep all take melatonin on their own. And so in my integrative fellowship, we had a lot of lectures on sleep and how to enhance sleep. And everyone that's studying this is taking melatonin every night. And so after learning that, I started taking melatonin on my own. I think for SARS-CoV-2, taking higher doses is probably good. If just in general, since we're talking about this, if you want to take melatonin to just help your sleep, less is actually more oftentimes to help get to sleep. So you can actually take a small amount, like a 0.5 milligram, and that will, I think of it as, that's the announcement system to your body that, hey body, it's ready to start changing some things to get ready to sleep. So it just signals to your body that it's ready, and you don't need a big signal. The higher doses of melatonin have been shown to be protective with things like cancer and also, like we talked about with the SARS-CoV-2 with the inflammasome. So I think for anyone that is just kind of trying to help their general immunity and decrease their risks with SARS-CoV-2 right now, high dose melatonin of 20 is great. Other things that I think help with sleep are just having good sleep hygiene, which I'm sure that you have talked about on the podcast before. CBD, I think, is helpful with inflammation and helping people get to sleep as well.
So those are some really, really great points. And for those of us who are listening who are coming from just kind of the general public aspect, I think the take-home message is that more sleep and healthier sleep reduces the cytokine storm, or reduces our chance of having the cytokine storm. I want to also take a moment to discuss one of my favorite articles that I've seen in the literature, which is this COVID-19 melatonin as a potential adjuvant therapy. And this really highlights the mechanism by which melatonin, in particular high-dose melatonin, could reduce the cytokine storm in patients who actually had advanced disease as a result of COVID-19. And I think it was a very, very interesting study and related to the specific mechanism by which it impairs the cytokines. So I would encourage you, we've discussed it before, I'm not going to go into too many details, but I would encourage you, if you're someone from the medical side, to look into this paper because it's pretty interesting. But I'd like to get back to some questions, because I'm sure that the supplements are a hot topic, but there's also some supplements that potentially could exacerbate, or at least have been reported to potentially exacerbate. So what are your patients asking you about those supplements that could actually potentially worsen the cytokine storm? That's
a great question that I'm getting a lot of questions about from my patients. And you've already said this, and I just want to clarify that, we're gathering more data by the day here. And a lot of this is extrapolation from what we know from looking at other viruses such as influenza and SARS-CoV-1. And so we don't necessarily have data that shows that any of these things I'm going to talk about are necessarily harmful, but because of the way that they work, a lot of supplements that we recommend people take to, quote, boost their immune systems, I think that's probably an inaccurate way that we describe it. Really, what all these supplements do is they're immune modulators, and what we want, we talk about a lot in medicine that we want the perfect dose of something, right? So with anything, if you take too much of it, you can have negative effects, although I just said that doesn't happen with melatonin. But with most things, too much can be harmful and too little can be harmful, or too little, you won't get an effect. And so we want the kind of the perfect amount. And with some of these immune modulating supplements, what can happen is it does upregulate the immune system. And there's evidence that can increase those cytokines that I talked about, the IL-1B and the IL-18. And so for that reason, when people actually become infected, I'm kind of steering people away from a few common supplements that I think people regularly take when they get viruses in general outside of SARS-CoV-2. And so vitamin D, we talk a lot about vitamin D and the benefit for the immune system. And, there's correlations with low levels of vitamin D in almost every disease process out there. So in general, I really am recommending people are on vitamin D to keep their levels somewhere between 60 and 80. However, when people actually develop SARS-CoV-2, when they start to develop symptoms, because of the immunomodulatory effect of potentially increasing production of those cytokines, I actually am recommending people do not take vitamin D while they are infected. So up until the point they get infected, absolutely. And then when they get infected, I'm currently recommending that people hold off until they get better again. Another one that is very popular is elderberry, Sambucus nigra. And that's been sold out. I've noticed it's been sold out on online pharmacies and in grocery stores and pharmacies for the last month. It's kind of hard to come by. And there's great evidence actually that it inhibits replication and viral attachment of actually another human coronavirus, so NL63. So I think taking elderberry before is great. And it also has level 2 evidence for prevention and diminishing symptoms with influenza. However, the way that it works also looks like it probably could increase our IL-1B and IL-18 production in infected immune cells. So basically increasing the probability of a cytokine storm. So that's another one that I recommend right up until people get sick. But if they're starting, and I should say with sick, if people have mild symptoms, probably none of these warnings are really important. But it's when people start to get really bad respiratory symptoms, it seems like they're having the cytokine storm. Certainly anyone that is heading into the hospital should, I would say at this point, probably should exercise caution with any of these supplements that I'm talking about. Another one is echinacea. A lot of people take that for its immunomodulatory effect. And that is one that I think would be fine before as well, although there's not as much evidence for that, but I would not take that when people get sick. Mushrooms are very popular. I know that you all have talked about mushrooms on the podcast, and I'm a big fan of mushrooms as well. But the polysaccharide extracts from medicinal mushrooms, they also, because of their immunomodulatory effect, potentially would increase the chance of having a bad cytokine storm. And so I think if the patient that I'm talking to seems to have really bad respiratory symptoms, I'm advising them not to take the medicinal mushrooms. And then the final one that I sort of steer people away from if they are sick is larch arabinogalactin. And all 5 of these supplements are excellent immunomodulators, and I'm not at all saying that people should not take those. It's just because of this risk of the cytokine storm that when people are quite sick with severe symptoms, they probably should exercise caution.
And I'm actually so glad that you mentioned elderberry and echinacea. I am getting a ton of questions from my own patients and in general when we did the summit about these as well, because there is some conflicting information out there, and I can understand why the lay public would look at that and say, should I take it or should I not take it? But those were great explanations of why maybe as a preventative supplement, it makes a lot of sense. But if you're starting to develop severe symptoms, maybe not a good idea. And the other thing I want to say is just in general, this is all so intensely personal, and sometimes past medical history and medication interactions and allergies come into play. So this is not really meant to be prescriptive in nature. This is general information. And I would always consult, your own physician to make sure that whatever supplements you hear about actually makes sense for you. Well, Dr. Mulcahy, thank you so much for coming on. Is there any other general advice? Are there any other questions that you want me to ask you, or anything else that you want to let our listeners know?
Well, I think two things that I'd like to just touch on briefly is in terms of supplements and immune modulation. I know you all have talked about peptides a bunch, so I'm not going to spend a lot of time on that, but I do want to mention that I am a big fan of the thymosin alpha as well, and I have been giving that to a lot of patients. A lot of the frontline workers, I'm giving them thymosin alpha prophylactically, and then I'm giving people thymosin alpha to take when they develop acute symptoms, and that also is upregulating the immune system. It's upregulating the thymus gland and allowing us to produce more natural killer cells, which are kind of our silent assassins. So I just wanted to mention that as well. And then the other thing that I am spending a lot of time coaching people on is stress management. And I think if people came into this pandemic without having any sort of stress management tools, in some ways, this is not the best time to start a meditative practice. We always talk about it's better to develop these practices so that you can use them in times of stress. And some people don't have that luxury. And so I think we're really lucky that due to online education in 2020 and due to a lot of really generous people out there right now, there's a lot of amazing online programs that are either free or discounted during this pandemic. We know that psychological stress is going to increase inflammation and it's going to increase the cytokines. And so we know that by decreasing stress and basically anything that gets us into our parasympathetic nervous system is going to upregulate our ability to fight the coronavirus. A couple programs that I really like and I think are easy on-ramps for people that have never done any sort of meditation or breathing exercises are the Ziva meditation program and Wim Hof method. And both of those are free or discounted for everyone, and I believe free for frontline workers. So I'm really recommending to my patients to kind of check those out. The 4-7-8 breath is super easy. I've been teaching that to patients, even in the ER when people are acutely stressed. I will have them do some breathing, and that is very simple. It's just 4 counts to breathe in. You hold it in for 7 counts and then 8 counts out through your mouth. And it's amazing that just doing that will completely shift your nervous system into more parasympathetic. And when I have people in the ER who are, tachycardic and really anxious, do those breathing exercises, even sometimes people that are in things like AFib with RVR, I'll have them do that and their heart rate will come down just by decreasing the stress hormone production. So anything that we can do to get people into their parasympathetics. And I think gratitudes are really important. It's easy right now to look at everything as kind of the world is caving in, but there's a lot of wonderful things that we can find in our lives every day, no matter where we are. And so focusing on those things and training our brains to look for the positives are also going to kind of help us to weather this storm. I think it's important for us to be knowledgeable or informed, I guess, about what's going on. And I know I have found that the news can be incredibly stressful, and I think most people are finding that. And so I really am recommending that people don't look at the news or read it at night. And I like, people having sources like your podcast to get information without potentially getting caught up in a lot of fake news. I'm getting a ton of questions from patients with, forwarded Facebook posts and things like that with what I consider to be likely incorrect information. And that is just making people more and more stressed, which decreases their body's ability to fight this virus.
Yeah, I can't imagine why people would need some stress management at a time like this. No, joking aside, I think the news point is an excellent point. And even if it's not fake news, I mean, even the very nature of news articles is that you tend to focus on kind of the sensational or the rare but scary things, like, children who die with COVID. And we don't necessarily all know the details of that. Sometimes children would have died of something else, which is tragic in and of itself, but they might have happened to have COVID. And in this time, it gets reported as the cause of death when we don't really have all the details. So that's a really, really good point, just to not focus on those and not pay too much attention. Could you also speak to the side effects and the risks of stress management?
You'll be happier, and your friends and family will like you more. That's a side effect.
I love hearing that.
Yep.
Well, thank you so much again for joining us. This is again Dr. Allison Mulcahy, and hopefully we hear more from you in the future. Stay well, and thank you all for tuning in. We'll be releasing these daily, so keep tuning in for updates. And again, thank you for your attention.
Thanks, Jeremy.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at Wild Health MD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.